from those red list countries immediately have to go into government-mandated quarantine hospitality.
Mr. Speaker, I'm intrigued by the Prime Minister's answer. I don't think he disputes what Sage's view was, that only a complete closure or comprehensive quarantine of all arrivals will work. He doesn't seem to dispute that. He says it simply wasn't a recommendation. I would ask the Prime Minister to publish the full Sage minutes so that we can see what was said in full, or if there's some other advice, perhaps publish that. Because the situation is this: we know the South African variant is spreading across England and measures are in place to try to deal with that. We also know that other variants are out there in other parts of the world. So is the Prime Minister really saying, just as a matter of common sense, is he saying that quarantining all arrivals would make no difference to fighting new variants of the virus? Or is he saying that quarantining all arrivals at the border would make a difference, but it's too difficult to do it?
Prime Minister.
Mr. Speaker, this is the right honourable gentleman who only recently said that quarantine measures were a blunt instrument, and whose Shadow Transport Secretary said that quarantine should be lessened. We have one of the toughest regimes in the world, and I think when he calls for a complete closure of borders, or suggests that might be an option, Mr. Speaker, he should be aware that 75% of our medicines come into this country from the European continent, 45% of our food. 250,000 businesses in this country rely on imports. It is not practical completely to close off this country, as he seems to be suggesting. What is practical to do is have one of the toughest regimes in the world, and to get on with vaccinating the people of this country, which is what we are doing, Mr. Speaker.
Mr. Speaker, what he says about the Labour position is complete nonsense. He knows it. It's the 3rd of February 2021. With new variants in the country, our schools are shut and our borders are open. Everybody knows there are exceptions, whatever the quarantine regime. Everybody knows that. And that's not what this question is about. The position is this: 21,000 people are coming into this country every day. The Prime Minister's new border arrangements are still weeks away from being implemented and will only affect direct flights from some countries. We know from the first wave of the pandemic that only 0.1% of virus cases came from China, where we had restrictions, whereas 62% came indirectly from France and Spain, where there were no restrictions. Why does the Prime Minister think that the variants of the virus will behave differently and only arrive in the UK by direct flights?
Prime Minister.
Mr. Speaker, he can't have it both ways. He simultaneously says that he wants the borders to be kept open for freight reasons, or to allow businesses to carry on. I think that was what he was saying, whilst calling for tougher quarantine measures, which is exactly what this government imposed as soon as we became aware of the new variant, Mr. Speaker. And as I repeat what you have to do. If you want to come into this country from abroad, you have to, 72 hours before you fly, you have to get a test, Mr. Speaker. You have to have a passenger locator form. You're kicked off the plane if you don't have it. You then have to spend 10 days, Mr. Speaker, in quarantine. If you come from one of the red list countries, Mr. Speaker, you have to go straight into quarantine. And all this, of course, is to allow us to get on with the vaccination programme. And if it had listened to the right honourable gentleman, Mr. Speaker, we would still be at the starting blocks, because he wanted to stay in the European Medicines Agency, Mr. Speaker, and said so 4 times from that dispatch box.
Nonsense. Don't let the truth get in the way of a pre-prepared gag. Mr. Speaker, the Prime Minister knows I've never said that from this dispatch box or anywhere else, but the truth escapes him. Mr. Speaker, he describes the current arrangements. If they were working, the variant wouldn't be in the country, the single biggest threat to the vaccine system. Mr. Speaker, let me turn to another area where the government's been slow to act: the cladding crisis. This is affecting millions of people. And I can't tell the Prime Minister how anxious and angry people feel about this. It's now 3.5 years since the Grenfell tragedy, which took 72 lives. So can the Prime Minister tell the House and the country why, 3.5 years on, are there still hundreds of thousands of people living in homes with unsafe cladding 3.5 years on, and why are millions of leaseholders in homes that they can't sell and facing extortionate costs?
Prime Minister.
Mr. Speaker, in respect of the Honourable Gentleman's last answer, may I advise him to consult YouTube, where he will find an answer. He raises a very important point about cladding and the predicament of some leaseholders, of many leaseholders, and he's absolutely right, Mr. Speaker. This is a problem that needs to be fixed. This government is getting on with it. 95% of the high-rise buildings with unsafe ACM cladding have been, work is either underway, they are either complete or underway to remove that cladding, Mr. Speaker. I very much appreciate and sympathise with the predicament of leaseholders who are in that situation, but we are working to clear the backlog, and I can tell him that my right honourable friend, the Chancellor and the Community Secretary will be coming forward with a full package to address the issue.
Yes,
Mr. Speaker, whatever the Prime Minister claims being done isn't working. Because this is the situation. Through no fault of their own, huge numbers of people, especially leaseholders, are stuck in the middle. They are living in unsafe homes. They can't sell, and they're being asked to foot the bill. That's the situation that they are in. Take, for example, Will Martin. He's a doctor who's got a flat in Sheffield. He's been spending his days on the front line fighting COVID in the NHS. He spends his nights worrying about the £52,000 bill that he now has to pay for fire safety repairs. He doesn't want future promises, Prime Minister. He doesn't want to hear that it's all been sorted when he knows that it hasn't. He wants to know here and now, will he or will he not have to pay that £52,000 bill?
Mr. Speaker, we're determined that no leaseholder should have to pay for the unaffordable costs of fixing safety defects that they didn't cause under no fault of their own. And that's why, in addition to the 1.6 billion we're putting in to remove the ACM and the UPL cladding, we are also setting up and have set up a £1 billion building safety fund, which has already processed over almost 3,000 claims. And I sympathise very much with the gentleman Dr. Martin, that he mentions, and I hope very much that his particular case can be addressed in the course of the forthcoming package that will be produced by my right honourable friends.
Yes,
There are thousands and thousands of people in exactly the same position. I spoke to leaseholders caught in the middle of this on Monday. One of them was Hayley. She's already gone bankrupt, Mr. Prime Minister. She's 27. She bought a flat, she's lost it, she's now bankrupt. It's too late for her. Those leaseholders that I spoke to had three very simple asks. This is what they want: immediate upfront funding for unsafe blocks, a deadline of next year to make buildings safe, and protection for leaseholders. We put those forward for a vote on Monday. The Prime Minister says he's determined to do something about it. What did he do? He ordered his MPs to abstain. If the Prime Minister is serious about moving this forward and ending this injustice, will he commit today to those simple asks from leaseholders?
Mr. Speaker, we're getting on with the job of helping leaseholders across the country by remediating their buildings. And in addition to the funds I've already mentioned, I can tell him that we're also introducing a £30 million fund to install alarms and other interim measures. And we're making it very clear to the mortgage industry that they should be supporting people living in such accommodation, and and making it clear to all sectors of the industry that people living in such homes should not be tied up in the whole EWS1 process. And that will benefit about 450,000 homeowners, Mr. Speaker. I think he's right to raise the problem, but we're getting on with addressing it, Mr. Speaker. And we're getting on with addressing the fundamental problem that afflicts this country, and that is the COVID
There's a lot more questions. Who's going to allow you to do that? And the first one's going, Marco Longi.
Thank you, Mr. Speaker. And may I join the Prime Minister with his moving words towards Captain Sir Tom Moore, who was an inspiration to each and every one of us in this country and beyond, may I say. Mr. Speaker, the Priory Boxing Club in Dudley has produced many champions, including Ryan Aston, who became champion 5 times in this country. May I ask the Prime Minister to join me in paying tribute to Paul Goff at the club, who is working with young boys and girls who are often who have been excluded from mainstream education. And may I ask him also to pay tribute to the council leader, Patrick Harley, who has agreed and is supporting a new school in partnership with the club to ensure that these young people are actually going to be getting academic qualifications, as well increased self-belief and new opportunities for the future.
Mr. Speaker, I thank my honourable friend for raising this excellent club, and I'm happy to join my honourable friend in paying tribute to the work of Paul Goff and Patrick Harley, everybody at that Priory Boxing Club. And I know from personal experience what a huge difference it can make, not just to young people's fitness, but also to their educational success to attend boxing clubs, Mr. Speaker.
Let's head up to the leader of the SNP in Skye and Lochaber, Ian Blackford.
Thank you, Mr. Speaker. And can I associate myself with your remarks about the remarkable gentleman, Captain Sir Tom Moore, everything that he's done. He has been an inspiration to each and every one of us, and I would like to send my condolences to his family and friends. Mr. Speaker, last week we told the Prime Minister it was wrong for him to visit Scotland in the middle of a pandemic. We told him it was a non-essential visit. Mr. Speaker, this morning, the Daily Record newspaper revealed that the Prime Minister knew that the Livingston plant that he was visiting had an outbreak of 14 COVID cases just 24 hours earlier. There are serious questions to answer. Did the Prime Minister and his advisors know about the COVID outbreak? When did they know? And when did the Prime Minister make the irresponsible decision to go ahead with what was a PR stunt?
Minister.
Mr. Speaker, I can think of a few things more important than to see the rollout of the vaccination programme across this country, to encourage the wonderful companies who are doing great work across the whole of Scotland, to see the commitment of those Scottish scientists to helping us all to defeat the pandemic. And it was fantastic to talk to them, Mr. Speaker. And I would just repeat that the government remains, as I said yesterday, very willing to help Scotland with the rollout of vaccines across the whole of the UK.
Returning to Ian Blackford. Ian Blackford.
And there is the wow factor once again with the Prime Minister. What an absolute shambles that he's gone to a plant where there was a COVID outbreak, and the Prime Minister can't just explain away this absolutely shocking error of judgment. Anyone can see that his campaign trip to Scotland was utterly reckless. The Daily Record story is very clear. The Prime Minister and his advisors knew there was a serious COVID outbreak at this plant. They knew the visit posed a risk, but they made a deliberate choice. They made the irresponsible choice. The Prime Minister put politics before public health. Prime Minister, why be so reckless? Is it any wonder that people in Scotland have no faith in this Prime Minister? Isn't he the worst possible leader at the worst possible time?
Mr. Speaker, I think what the people of Scotland want to see is the whole country pulling together and working to develop the vaccine, as that fantastic plant in Scotland is doing. One of the advantages of the Valneva vaccine is that it may be able to combat all sorts of variants in a very comprehensive way. It's amazing, wonderful to see Scottish scientists working to do that. I had a fantastic time. Nobody, by the way, raised that issue with me before or since, and it is my job, Mr. Speaker, to visit every part of this country. Nothing and no one, Mr. Speaker, is going to stop me, and I am very, very proud of the record of the government in rolling out the vaccine. As I say, the offer, it remains open to the Scottish Nationalist Party, where their National Party, if they insist, though they are also nationalists, Mr. Speaker, were there to help the rollout of the vaccine if do more were they to decide that is necessary, Mr. Speaker.
Thank you, Mr. Speaker. Closing the attainment gap has always been at the heart of our education policy, and yet we know that the pandemic is having a devastating effect on our children's education. I welcome the Prime Minister's commitment to prioritise the opening of our schools. Would he also agree with me that we must put the catch-up of children's missed education at the centre of our recovery programme?
Yes, indeed, Mr. Speaker. That's the single most, I think, of all the challenges now facing the country, it is remedying the damage to children's education. Yes, of course, we've got to clear up the backlog in the NHS. We have problems in the courts, but it is education that is going to be the focus of this government, Mr. Speaker, and repairing the differential learning that's taken place during the crisis.
Let's head to Northern Ireland with Stephen Farry. Stephen Farry.
Thank you, Mr. Speaker. We need to be open and honest on the reasons why the Northern Ireland Protocol exists, but do all we can to make its implementation as easy as possible. So in that spirit, in the talks with the EU that will take place over the coming days, will the Prime Minister make it a priority to seek a UK-EU veterinary agreement, which would help both with respect to the Northern Ireland Protocol, but also all UK food exporters?
Mr. Speaker, I'm very grateful to the honourable gentleman, and we do think that it is very important that the protocol should not place unnecessary barriers or barriers of any kind down the Irish Sea. It was, as I said to a colleague earlier, I think it was most unfortunate that the EU seemed to want to impose a barrier across the island of Ireland. We seek to make sure there are no such barriers, Mr. Speaker, down the Irish Sea.
Let's head to Gloucestershire with Lawrence Robertson. Lawrence Robertson.
Thank you, Mr. Speaker. Some of my constituents had their Christmases ruined because the heavy rainfall and local inappropriate development caused foul water to enter their homes, causing them great difficulties. So will the Prime Minister appoint a statutory body with the specific and undeniable responsibility of ensuring that no developments can automatically tap into existing drainage systems, and that before developments begin, a full assessment is made of the local drainage capacity, and if that capacity would be inadequate, that the development does not begin until the infrastructure is upgraded?
Prime Minister.
Well, I will study the very interesting proposals that my honourable friend makes, but in the meantime, I will raise them particularly with the Environment Agency, who I think do a fantastic job in managing local areas that are prone to flooding, to putting in the necessary defences. And I know that our colleagues across the House will have seen the work of the Environment Agency across the country, and we're making another £5.2 billion investment into additional flood defences, which I know will benefit his constituents in Gloucestershire and across the country.
Sorry, thank you, Mr. Speaker. The Prime Minister was not born in this country. My parents were not born in this country. I was, but we are all British. There are, however, hundreds of thousands of children, including in my constituency in Stretton, who, like us, born or raised here, are entitled to citizenship but priced out by a £1,012 fee. Without it, they face barriers to university, work, healthcare, renting a home, or opening a bank account. Does the Prime Minister agree with me that it's wrong that the government makes 60% profit on these applications? And will he take steps to reduce or even end citizenship fees for children?
Mr. Speaker, I think that British citizenship is a wonderful thing, and it's fantastic that so many EU nationals have taken up the opportunity to become British in the course of the last few years. I'm interested in the point that the honourable lady makes. I will study it, but clearly there are costs that must be borne by the taxpayer, and I think that she will appreciate that citizenship at any time of life is a very considerable prize and worth investing in.
Thank you, Mr. Speaker. The police have been one of our public services who've been absolutely essential during the pandemic. So will my right honourable friend join me in welcoming the fact that the Kent Police and Crime Commissioner Matthew Scott has announced another 145 police officers during this year, bringing to the total of 800 extra police we have on the streets of Kent. And most importantly, that this has been accompanied by a reduction of 17,000 in the crime numbers in Kent this year.
Prime Minister.
Mr. Speaker, I thank my right honourable friend, who's a long-standing and redoubtable campaigner for law and order and for the police, and I also congratulate Police and Crime Commissioner Matthew Scott for what he's doing to back the police and to recruit more police in Kent, and that's why we are putting another 20,000 more officers on the streets of this country, and I think we've already recruited about 6,000, Mr. Speaker.
Let's head up to the northeast with Julie Elliott. Julie Elliott.
Thank you, Mr. Speaker. Last week, the government responded to concerns from our care workers by stating, "We're immensely proud of all our care workers do." This is a sentiment we all share, yet in the very same statement, the government sought to pass the buck for the way our care workers have been treated by saying the vast majority of care workers are employed by private providers and that the government does not set levels of pay for care workers. Why won't this government commit to ensuring our care workers are paid a wage they can live on?
Mr. Speaker, this government is proud of not only setting up the national living wage, but making sure that we had record-breaking increases both last year and this year. And that is the most important thing we can do for care workers and workers across the country.
Let's head up to see Joy Morrissey. Joy Morrissey.
Thank you, Mr. Speaker. And may I thank the Prime Minister for prioritizing schools during this pandemic. And will the Prime Minister confirm that this remains the case? And on Children's Mental Health Week, will the Prime Minister work with parents and frontline children's charities to minimize the disruption to children and to their mental health caused by this pandemic?
Prime Minister.
I'm grateful to my honourable friend for what she does to champion this very, very important cause. And it is Children's Mental Health Week this week, and partly in recognition of the extent of the problem and the issue across the whole of the country, we've announced a new youth mental health ambassador who's going to be working with the government, Dr. Alex George, who'll be working with the government to underline the importance of mental health resilience, Mr. Speaker, and making everybody in our country better able to deal with some of the problems that life throws in our way.
Into Northern Ireland with Ian Paisley. Ian Paisley.
Thank you, Mr. Speaker. And may I too express condolences to the family of Captain Sir Tom Moore, an inspirational and wonderful gentleman. Prime Minister, you say that your commitment to Northern Ireland is unshakable. Well, I speak for all of my constituents today when I tell you that the protocol has betrayed us and has made us feel like foreigners in our own country. Tea and sympathy will not cut the mustard. So what is the Prime Minister actually going to do when the Prime Minister realises that the EU will do nothing to help Northern Ireland? Will the Prime Minister use all of the instruments at his disposal? Will he use, if necessary, his parliamentary majority? Will he legislate, if necessary, to remove the impediments to trade in Northern Ireland? And will he be a man of his word and allow businessmen in my constituency to bin the unnecessary documentation that he told us we could bin? Prime Minister, be the unionist we need you to be.
I utterly share the frustration of the honourable gentleman about the way the EU, in particular, the EU Commission, temporarily seem to call for you to use the protocol in such a way as to impose a border contrary to the spirit of the Good Friday Agreement, contrary to the letter of the Good Friday Agreement. And we will do everything we need to do, Mr. Speaker, whether legislatively or indeed by invoking Article 16 of the protocol, Mr. Speaker, to ensure that there is no barrier down the Irish Sea, and the honourable gentleman's business constituents, some of whom I know very well and admire very much, can continue to do business unfettered between Northern Ireland and the rest of this country.
Speaker, may I congratulate my right honourable friend on his calm handling of the European Commission's misbehaviour over vaccines in Northern Ireland. Nevertheless, we can learn something from our European friends. Andalusia, a Spanish province of 8 million people, had a COVID death rate of about 190 deaths per million in November, higher than ours at the time. After giving activated vitamin D, calcifediol, to care home residents and some GP patients, that death rate almost halved, whilst ours was doubling. Can he ask his advisors to look urgently, again, at the very latest Spanish research about this cheap, safe and apparently effective treatment?
I'm very grateful to my right honourable friend, and we will continue to monitor all the evidence about the efficacy of vitamin D in the treatment that he mentions. I'm well aware of it, and indeed we've discussed it before personally, Mr. Speaker, and I'll keep him updated on the review that's currently taking place.
Let's head up to the northwest with Rosie Cooper. Rosie Cooper.
Thank you very much, Mr. Speaker. Scammerdale residents believe that they are an island of forgotten people. It's a 60s new town with very poor public transport and one of the lowest levels of car and vehicle ownership. For many, the only means of getting to doctors, schools, shops or visiting loved ones is through 87 underpasses, many of which flood every time there's rain. Will the Prime Minister ask his officials to work with Lancashire County Council to find and fund a permanent, and I do mean a permanent solution, which doesn't involve providing canoes? Thank you, Mr. Speaker.
I appreciate the desire of the honourable lady to. I am aware of the problem that she refers to in the flooding in the underground in the tunnels. We will certainly work with Lancashire County Council to mitigate the problem, to sort it out. But we are, and just to repeat, we have the funds available, and we'll make sure that it's done, Mr. Speaker.
Jenkinson.
Thank you, Mr. Speaker. We were delighted to hear that Maryport in my constituency of Workington was successful in our bid for a future High Streets Fund. One of my right honourable friend's 50 additional towns announced last August, and a bid I led when I was deputy leader of Allerdale Borough Council. We're hoping too for a positive outcome to our Towns Fund bid for Workington. Can I take this opportunity to thank my right honourable friend for all he's doing for my constituents and levelling up across the United Kingdom, and invite him, as soon as he's able, to visit my constituency to see for himself its potential.
Well, I want to thank my honourable friend, who is a fantastic advocate of the people of Workington, and never fails, Mr. Speaker, to put their interests before me. And I will do everything I can to help him, and I will check my diary commitments to see when I can get there, and I hope it will be as soon as possible.
Let's head to Wales with Howell Williams. Howell Williams.
Thank you, Mr. Speaker. Delivery of important letters, packets and parcels in the Carnarvon area have been delayed for days and weeks by a COVID outbreak amongst local postal workers. The Prime Minister will, I'm sure, join me in wishing my constituents a speedy recovery. But what is his government doing during this health crisis to make sure that the once world-beating, but by now privatised Royal Mail is sufficiently robust to fulfil its duty to the public, particularly in rural areas?
Mr. Speaker, the most important thing we can do, and I pass on my sympathies to all those affected by the outbreak of COVID that he describes. I think the most important thing we can do is continue to roll out the vaccination programme, and we want to get key workers such as postal workers as fast as we possibly can. We're already at 10 million across the whole country. We've got to get down the JCVI groups 1 to 9, Mr. Speaker, the most vulnerable groups. But postal workers over 50 will certainly be included in that group. But after that, we want to get down to all key workers who come into regular contact with others and who may be exposed to the virus, Mr. Speaker.
Kent with Tracy Crouch. Tracy.
Thank you, Mr. Speaker. The Prime Minister will be aware that the second wave of coronavirus has had a significant impact on the mental well-being of frontline nurses and doctors, with many in critical care units facing continuous shifts with dismal survival rates, causing a level of psychological harm that may result in PTSD. With this in mind, Will he look at utilising the military understanding of this condition and urgently invest in training sufficient numbers of psychology professionals to support our heroic nurses and doctors fighting on the front line of this battle against COVID-19?
Prime Minister.
Mr. Speaker, my right honourable friend raises an extremely important point about PTSD in the NHS and NHS staff who do an amazing job treating us all. And I will certainly look at the particular recommendation that she now makes, but clearly we're as part of the £52 billion package of investment that we're making in the last year into the NHS. We will be making sure that we support staff working on the front line, their mental health, and making sure that they have all the health and well-being helplines that they need, all the advice and counselling that they need to get through what has been for all of them a really, really difficult time.
Let's head up to Lanark with Angela Crawley. Angela Crawley.
Thank you, Mr. Speaker. Yesterday, the Scottish Government announced that they would go further than the Prime Minister and introduce a comprehensive system of supervised quarantine for those entering the country. It is evidently clear that countries that have employed an effective international quarantine measure are now reaping the rewards of reopening their economies and reducing the unnecessary loss of life. Faced with the overwhelming evidence that importing new cases and variants could undermine our efforts again, why is the Prime Minister watching, waiting and hoping for the best when we know that his dithering on crucial decisions has already had catastrophic consequences?
Mr. Speaker, I don't think anybody wants to take any lectures on speed of rollout or delivery of programmes from the Scottish Nationalist Party. But I want her to know that the government will be very, very happy to help with accelerating the rollout of the vaccine programme, as we said yesterday, and the offer is there. And vaccination of the people of this country is the single most important thing we need to do now together to beat this pandemic.
Let's head to Hertfordshire with Stephen McPartland. Stephen McPartland.
Thank you, Mr. Speaker. Millions of leaseholders are living in fear because they have no idea how safe their buildings are, and they're also facing staggering bills which they cannot afford. Can the Prime Minister assure me that leaseholders will not have to pay to fix these historic fire safety defects, and also rule out loans to leaseholders, which are not a solution?
Yes, Mr. Speaker, as I said earlier on, we're absolutely clear that leaseholders should not have to worry about the cost of fixing historic safety defects that they didn't cause, but I appreciate the sympathy and care with which he represents their interests.
We're now heading to Stephen Timms. Stephen Timms.
Thank you, Mr. Speaker. It's been estimated that 40,000 people were scammed out of their pensions in the 5 years after the pension freedoms took effect in 2015. Attractive deals on Google or Facebook turn out all too often to be a fraud. So will the Prime Minister ensure that the planned online harms bill tackles online financial harms in order to address this very serious problem?
Prime Minister.
He makes an excellent point, Mr. Speaker, about online fraud. It is becoming an increasing concern of the government, and I think of people across the country. People must be vigilant. We will look at what we can do, as he suggests, with the online harms bill or any other measures to protect people, particularly pensioners, against fraudsters online.
And don't forget, the Prime Minister is asking the countries to get together and clap at 6 o'clock. I'm now suspending the House for 3 minutes to enable... No, they can't come back. I'm just going... Point of order, is it related to Prime Minister?
Mr. Speaker, if it assists the House, perhaps I could help to correct the record. On the 31st of January 2017, the Right Honourable Gentleman opposite told the House, as recorded in Hansard, why would we want to be outside the European Medicines Agency, which ensures that all medicines in the EU market are safe and effective?
Order. We're not continuing the debate. That correction will be on the record, but I'm not reopening a debate. I'm suspending the House for 3 minutes to enable the necessary arrangements for the next business to be made. Order.